Easy ways seniors can lower blood pressure with food after 60. 2 years ago, a woman named Gloria sat across from me in a consultation room. She was 71, retired schoolteacher, loved her grandchildren more than anything on this earth. She had been on blood pressure medication for 9 years, 3 different pills, morning and night, and still, every time she checked her numbers, they hovered in a range that frightened her. She looked at me and said something I will never forget. She said, "I have done everything they asked me to do. I take every pill, I cut the salt, I walk when my knees let me, and I am still afraid to go to sleep at night, because I don't know if my heart will be there in the morning." That sentence broke something open in me. Because Gloria was not doing anything wrong. She was doing everything right. The problem was that nobody had told her the rest of the story. Nobody had sat her down and explained that 5 things, already sitting in her kitchen, ordinary foods she had walked past 1,000 times, could become some of the most powerful allies her cardiovascular system had ever had. That is what this video is about, not replacing your medication. I want to be absolutely clear on that from the very beginning. This is about giving your body additional tools, real ones, backed by published clinical research, that work alongside what your doctor has already prescribed. Tools that, in many cases, have shown results comparable to adding another prescription without the side effects. And if you have been searching for someone who explains this kind of information honestly, without hype, without selling you a miracle, then you have found the right place. Because that is exactly what we do here, week after week. And I intend to keep doing it for as long as people like Gloria need to hear it. Now, let me explain what is actually happening inside your blood vessels after 60. Because once you understand this, everything else will make sense. When you were younger, your arteries were soft. They stretched with every heartbeat, like a rubber band, absorbing the pressure, releasing it, absorbing it again. Smooth and rhythmic. Your body handled it effortlessly. But as the decades pass, something changes. The walls of those arteries begin to stiffen. They lose their flexibility. Imagine a garden hose that has been lying out in the sun for years. It gets rigid. It cracks. It cannot handle the same water pressure it once did, without strain. That is what is happening inside your body right now. And when those vessel walls become rigid, your heart has to push harder to move blood through them. That extra force is what shows up on the monitor as high blood pressure. But here is the part that most people never hear about. There is a molecule your body produces naturally that tells those stiff arteries to relax, to soften, to open up and let blood flow through with less resistance. It is called nitric oxide, and it may be the single most important molecule for blood pressure that you have never been told about. The scientists who discovered what nitric oxide does for blood vessels won the Nobel Prize in 1998. That is how significant this molecule is. When nitric oxide reaches the smooth muscle cells inside your artery walls, those cells relax. The vessel widens. Blood flows more easily. Pressure drops. Here is the problem. After 60, your body produces significantly less nitric oxide than it did when you were 40. The production declines year by year, and most people have no idea it is happening. So the question becomes very simple. How do you help your body make more of it? And that brings us to the first food. Dark leafy greens. Spinach, kale, arugula, Swiss chard. These vegetables are among the richest natural sources of dietary nitrates on the planet. When you eat them, your body converts those nitrates into nitric oxide through a pathway that starts in your mouth and ends in your blood vessel walls. A major study published in the European Journal of Epidemiology followed over 53,000 people for 23 years. The researchers found that people who consumed the most vegetable nitrates, primarily from leafy greens, had systolic blood pressure that was nearly 3 points lower. They also had a 15% lower risk of cardiovascular disease overall, a 17% lower risk of stroke, and a 26% lower risk of peripheral artery disease. And the amount that produced these benefits? It was not extreme. It was roughly 1 cup of raw leafy greens per day. 1 cup. That is a small side salad. That is a handful of spinach stirred into your morning eggs. Now, I want to be honest with you about something, because I believe you deserve honesty more than you deserve comfort. A well-designed clinical trial in the American Journal of Clinical Nutrition tested leafy greens specifically over a 5-week period and did not find a significant short-term blood pressure change. What that tells us is important. This is not an overnight fix. Leafy greens work as a long-term daily habit. They work the way compound interest works in a savings account. Small, consistent deposits that accumulate into something genuinely powerful over months and years. Not a quick withdrawal. So eat your greens every single day. Not because they will fix your blood pressure by Thursday, but because 6 months from now, your arteries will be measurably different than if you had not. Now, the second food takes that same nitric oxide mechanism and amplifies it dramatically. And when I first read the research on this one, I sat at my desk for a long time afterward, just thinking about how something so simple could produce results this significant. Beetroot. Specifically, beetroot juice. Beetroot is one of the most concentrated natural sources of dietary nitrate that exists. And unlike leafy greens, where the evidence is strongest over long periods, beetroot juice has been shown to lower blood pressure in controlled clinical trials within hours of a single dose. The landmark study was conducted at Queen Mary University of London and published in the journal Hypertension in 2015. 68 patients with high blood pressure drank 250 milliliters of beetroot juice daily, roughly 1 cup, for 4 weeks. Their clinic systolic blood pressure dropped by nearly 8 points. Their 24-hour ambulatory blood pressure dropped by over 7 points systolic and 5 points diastolic. And their endothelial function, which is a measure of how well your blood vessels are working, improved by approximately 20%. The researchers stated plainly that the magnitude of the reduction was comparable to single-agent antihypertensive drug therapy, comparable to a blood pressure pill, from beetroot juice. And here is a detail that matters enormously for anyone watching this who is over 60. A separate meta-analysis published in Advances in Nutrition reviewed 22 clinical trials on beetroot juice and found something remarkable. The older the participants were, the greater the blood pressure reduction. Your age is not working against you here. It is actually working in your favor. Your body is more responsive to this intervention precisely because nitric oxide levels have declined more significantly. 1 cup in the morning. You can juice raw beetroot if you have a juicer. You can buy pre-made beetroot juice at most grocery stores. Some people mix it with a little apple or carrot juice because the earthy flavor takes some getting used to. That is perfectly fine. What matters is the nitrate content, and it is there regardless of how you dress it up. One practical note. If you are taking blood pressure medication, beetroot juice can enhance the effect. That is not a reason to avoid it, but it is a reason to monitor your numbers and have a conversation with your doctor. You want your pressure to come down. You do not want it to drop too far, too fast. Work with your physician. Bring this information to your next appointment. The third food has a history that stretches back centuries across Africa, Latin America, and the Middle East. It was used in traditional medicine long before modern cardiology existed, and modern cardiology has now confirmed what those traditional healers understood intuitively. Hibiscus tea. You know hibiscus by many names depending on where you grew up. In the Caribbean, they call it sorrel. In Egypt, carcade. In Mexico, agua de Jamaica. My grandmother called it red tea, and she drank it every evening on the porch while the sun went down. She lived to 89. I am not saying the tea is the reason, but I am saying she knew something that a clinical trial published in the Journal of Nutrition would later confirm with data. In that study, 65 adults with mildly elevated blood pressure drank 3 cups of brewed hibiscus tea daily for 6 weeks. Their systolic blood pressure dropped by an average of 7.2 points compared to the placebo group. 7 points. That is clinically meaningful. That is the kind of number that changes a doctor's treatment decision. But here is what truly caught my attention. A separate head-to-head trial published in Planta Medica compared hibiscus extract directly against lisinopril, one of the most commonly prescribed blood pressure medications in the world. 193 hypertensive patients participated. The hibiscus group saw blood pressure reductions of over 17 points systolic and nearly 12 points diastolic. The researchers also measured ACE activity, which is the enzyme that prescription ACE inhibitors are designed to block. Hibiscus reduced that enzyme activity by more than 30%. Let me say that clearly. This flower was doing naturally what an entire class of pharmaceutical drugs was engineered to do. Without the persistent dry cough that makes so many patients stop taking their ACE inhibitors. A 2022 meta-analysis in Nutrition Reviews pooled 17 randomized controlled trials and confirmed it. Hibiscus reduced systolic blood pressure by over 7 points on average, and the difference between hibiscus and pharmaceutical medications was not statistically significant. 3 cups a day, hot or cold, no sugar, or just a small touch of honey if you need it, because added sugar will work against everything we are trying to accomplish here. If you are already taking an ACE inhibitor, talk to your doctor before adding hibiscus tea regularly. Combining a natural ACE inhibitor with a pharmaceutical one can push your pressure lower than intended. We want balance, not overcorrection. Now, the fourth food surprised me the most when I first encountered the research, because it contradicts almost everything the mainstream nutrition conversation has been saying for the past 30 years. Extra virgin olive oil. For decades, we were told to fear fat, use the vegetable oil, buy the low-fat dressing, avoid anything that feels rich or indulgent, and millions of people followed that advice faithfully, while their arteries quietly paid the price. The Predimed trial is one of the largest and most respected cardiovascular nutrition studies ever conducted. In a blood pressure sub-study, 235 participants at high cardiovascular risk, average age 66, were randomized to different diets. The group supplementing with extra virgin olive oil saw their 24-hour ambulatory systolic blood pressure decrease, while the control groups actually increased. The net difference between the groups was approximately 4 points. But there is another study that stopped me cold. Published in the Archives of Internal Medicine in the year 2000. 23 hypertensive patients used extra virgin olive oil as their primary fat for 6 months, then switched to sunflower oil for another 6 months. During the olive oil period, their need for blood pressure medication dropped by 48%. 8 of the 23 patients, more than a third, required no medication at all while using extra virgin olive oil daily. No medication at all. The mechanism is oleocanthal, a compound unique to extra virgin olive oil that acts as a natural anti-inflammatory. Chronic inflammation in the walls of your arteries is one of the primary drivers of stiffness and elevated pressure after 60. Oleocanthal directly opposes that process. And the monounsaturated fats in olive oil actively support the production of nitric oxide, the same molecule we talked about earlier. Use it on your salads. Drizzle it over roasted vegetables. Use it for light cooking. Replace the industrial seed oils sitting in your cupboard, the canola, the soybean, the corn oil, with a good bottle of extra virgin olive oil. That single change, practiced consistently, can shift your inflammatory markers and your blood pressure readings within months. The fifth food is the one Gloria started with, because I told her to pick just one, whichever felt easiest, and she chose this one, because she said it felt like a treat rather than medicine. Blueberries. A 2023 clinical trial published in the American Journal of Clinical Nutrition studied 61 healthy older adults between 65 and 80 years old. They consumed wild blueberry powder daily for 12 weeks. Their 24-hour ambulatory systolic blood pressure dropped by nearly 4 points, and their endothelial function, the ability of blood vessel walls to relax and dilate, improved significantly. But the study that truly made me pay attention was conducted specifically in postmenopausal women with elevated blood pressure, published in the Journal of the Academy of Nutrition and Dietetics in 2015. 48 women ate freeze-dried blueberry powder daily for 8 weeks. Their systolic pressure dropped by 7 points. Diastolic dropped by 5. Arterial stiffness decreased by 6.5%. And their nitric oxide levels surged by 68%. 68% more nitric oxide from blueberries. The compounds responsible are called anthocyanins, the pigments that give blueberries their deep purple color. They cross the blood-brain barrier, support cognitive function, and directly protect the endothelium of your blood vessels. A handful every morning, on your oatmeal, in a smoothie, or straight from the container, the way Gloria eats them, standing at her kitchen counter, one by one, like small purple promises. I want to stop here and say something that I think matters more than any study I have cited today. Gloria called me 4 months after that first conversation. She was not crying, she was laughing. She said her doctor had looked at her numbers and asked what she had changed. She told him about the beetroot juice in the mornings, the hibiscus tea she drank 3 times a day, the olive oil she drizzled on everything, the blueberries, the spinach she now ate before touching anything else on her plate. Her doctor did not reduce her medication, not yet. But he told her to keep doing exactly what she was doing. And for the first time in 9 years, her numbers were consistently in a range that neither of them had to be afraid of. She told me, "I finally stopped being scared to fall asleep." That is why this matters. Not because of the data, though the data is real. Not because of the mechanisms, though the mechanisms are sound. It matters because Gloria is not a rare case. She is you. She is your mother. She is the woman next door who takes her pills faithfully and still feels afraid. And she deserved to know that her kitchen held answers nobody had bothered to share. You deserve to know that too. 5 foods: leafy greens, beetroot juice, hibiscus tea, extra virgin olive oil, and blueberries. Every one of them supported by published clinical trials. Every one of them available at your local grocery store. Not one of them requiring a prescription. Pick one. Start tonight. Not all 5. Just one. The one that feels simplest. The one that feels like you. And build from there. Slowly, gently, the way anything worth building has always been built. Everything in this video is general educational information based on current medical research. It is not personal medical advice. Before making any changes to your diet or treatment plan, please speak with your own physician. They know your full history and your medications. That context matters more than anything I can share in a video. Take care of your heart. It has been beating for you every second of your life, without asking for a single thing in return. Tonight, give it something back.